What cancer symptoms can appear in blood tests? Have you ever wondered what signs of cancer can show up in blood tests? Blood tests can indeed reveal important clues about the presence of cancer, particularly in reproductive cancers like testicular and cervical cancer. While these tests do not provide a definitive diagnosis, they can indicate the need for further evaluation. Cancer cells can release various substances into the bloodstream, including proteins and genetic material. Advanced blood tests, known as liquid biopsies or multi-cancer early detection tests, analyze these components. They can sometimes detect cancer even before symptoms appear or before tumors can be seen in imaging tests. For reproductive cancers, blood tests may measure specific tumor markers. In testicular cancer, for instance, elevated levels of alpha-fetoprotein, human chorionic gonadotropin, and lactate dehydrogenase can be detected. For cervical cancer, elevated squamous cell carcinoma antigen levels may be observed, although this is less common for routine screening. Another important aspect is circulating tumor DNA. This refers to fragments of DNA released by tumor cells into the blood. Sensitive molecular tests can detect this DNA, indicating the presence of cancer even in its early stages. Changes in blood cell counts can also signal cancer. Some cancers may lead to anemia, which is a low red blood cell count, or an increase in white blood cells or abnormal platelet counts. These changes reflected the body's response to cancer but are not specific to cancer alone. Inflammatory markers, such as C-reactive protein, may be elevated in cancer cases, but they are not diagnostic by themselves. It's crucial to remember that blood tests alone cannot confirm a cancer diagnosis. They are part of a broader diagnostic process that includes imaging and tissue biopsies. Many blood markers can also be elevated in benign conditions or other diseases, so they are not exclusively linked to cancer. Research into early detection blood tests is ongoing, and while they hold promise, they are not yet standard practice. In practical terms, blood tests for testicular cancer help diagnose and monitor treatment through specific markers. For cervical cancer, blood tests are not the primary diagnostic tools, as screening is typically done through Pap smears and HPV tests. However, ongoing research into blood-based biomarkers may improve early detection in the future. In summary, blood tests can indicate cancer-related symptoms by detecting tumor markers, circulating tumor DNA, and changes in blood cell counts. For reproductive cancers, these tests are valuable tools for diagnosis and monitoring. Always consult healthcare professionals for personalized evaluation and care if you have concerns about your health.